Your dentist said you need a root canal. Here's what actually happens and why it's not what you fear. Inside every tooth is a soft core called the pulp, nerves and blood vessels running from the crown down into the roots. When decay, a crack, or trauma lets bacteria reach the pulp, it becomes inflamed and infected, and it cannot heal on its own. Signs often include a throbbing toothache, sensitivity to hot or cold, pain on biting, or a swollen gum near the tooth. Root canal treatment removes the infected pulp, cleans and disinfects the empty canals, then seals them shut to stop the infection. First, the dentist takes x-rays, numbs the area with local anesthetic, and places a thin rubber sheet to isolate the tooth. A small opening is drilled through the top of the tooth, and fine flexible files clean out the infected pulp from each canal. The clean canals are filled with a rubber-like material called gutta percha and sealed, leaving no space for bacteria to return. For back teeth, a crown is usually placed a few weeks later to protect the tooth from cracking under chewing pressure. Mild soreness for 2 to 4 days is normal. Most people go back to work the next day and manage with simple painkillers. Risks are uncommon, but include lingering infection, a cracked tooth without a crown, or slight darkening of front teeth over time. The main alternative is extraction, but major dental societies generally describe saving the natural tooth as preferable when feasible. A well-restored, root canal-treated tooth looks and functions normally, and with good care can last for many years, often a lifetime. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.